Exposure to certain types of molds not only pose a serious health threat, but can be fatal. Just about anyone can be exposed to these molds called mycotoxins. Joining us with more on mycotoxin illness is Dr. J.P. Saleeby, Medical Director at Carolina Holistic Medicine. Welcome back.
Good. This
is a subject that personally I can relate to, as I know someone who is suffering an allergic reaction to black mold. How common is this?
Well, it's pretty common actually, and especially if you live in the southeast with the high humidity and everyone has crawl spaces that get mold buildups and things like that. So there's exposure at home, in the car, a water damaged car, or in your place of work. Mm-hmm. There's a couple of ways you can get exposure, not only environmentally through the black mold, but there are other molds that aren't black. You can also get molds through food sources like your grains, so your rice and your corn. If they are moldy and we eat them, some of the chemicals released by these molds, even if you cook them, fry them, will persist, and then they go through into us, and those are called mycotoxins, right?
So they survive extreme heat?
Yes.
Is there any way to kill them off?
Not really. Another way to get it is through animals. So let's say you have chickens or pigs that are eating moldy grains. The mycotoxins go into their meat, and then when we eat their meat, ham sandwich or fried chicken, we're getting those mycotoxins passing through.
That blows my mind, because at any one time, all of us must have ingested at some point this mycotoxin, right?
Yeah.
But different people react differently to it.
That's correct.
So would this be considered a legitimate allergic reaction to a mycotoxin, as opposed to someone who does not have an allergy?
Yeah.
So
it's a little bit of both. If you have an allergic reaction, that's IgE or IgG reaction, that's usually to the antigen of the mold. But the mycotoxins are chemicals that are toxic to humans, and there's different ones. There's orotoxin, aflatoxin, there's many of them. And some of them are found in foods, some of them are found, let's say, on coffee beans, there's some, and then some are found in the environment. So they all can play different roles, and some people tolerate them better than others.
I was going to ask, why do some people tolerate it better than others?
Yeah, well, a lot of it has to do with our genetics, our genetic makeup. How healthy our immune system is, how responsive or reactive we are to certain things. Some people blow up, they get super reactive when they come in contact with certain chemicals or antigens. And then it also depends on the load, like how much of it are you getting? Is it a little bit of an exposure, or is it constantly all the time?
Can your chemical makeup change over time throughout exposure to these mycotoxins? Because I'll just use myself as an example. Moving to the south, where it's very humid, I was not accustomed to the humidity, the moisture, the constant moisture, and like you say, there's molds around us everywhere, especially in the southeast. And I was just noticing I'd get, a rash, or just some kind of upper respiratory issue. But then it all subsided, it went away, and I seemed to get used to it. So is that possible?
Sure. Okay. So it's like what we call epigenetics. It's like what your genetics are and what the environment on top of it produces an effect. Now, at some point, your body may compensate or get used to or become desensitized to it. That's the whole theory behind immunotherapy with the allergy shots.
Right.
You're getting small doses of an antigen until your body sort of ignores it. So that can happen.
So mycotoxins, they're all over. They're around us all the time. How do we protect ourselves? So not knowing if we're going to have that severe reaction to it, how do we protect ourselves?
Okay, so if somebody's sensitive, to avoid exposure. So make sure you have your home inspected by a certified inspector. And if it needs remediation, there are very good remediators that will fix the problem. You want to also make sure if it's a water damaged house, that you do it. It could be brand new.
Sure.
Mold only takes like 4 days to start growing, so it could be a brand new house. You want to make sure you don't neglect your car. If you have a water damaged vehicle, that could be the source. And your place of work. You want to also look for other underlying chronic illnesses that may make this problem worse. So somebody with underlying vector-borne illness, if they have mycotoxin illness on top of it, it's worse.
I'm sure.
We've seen COVID infections make people flare up. They may not be sensitive until they've had COVID.
Yeah.
And then all of a sudden they're sensitive.
Once you've been exposed and you're noticing a reaction, first of all, what are some common symptoms? Just about 3 common symptoms.
Headaches, malaise, and rashes, odd rashes.
Okay, and then if you notice that you are having that sort of a reaction, is there anything holistic that you can take to help treat it?
Sure. Well, first is avoidance. So number 1, 2, 3, avoid, avoid, avoid. 4, 5, and 6 are things like supporting your immune system, supporting your mitochondria, and binders. There are certain things that will bind and take these things out.
Okay, great advice. For people who want more information, where should they go?
Sure. CarolinaHolisticMedicine.com, and we'll be happy to educate and treat folks with this condition.
And you're educating us right now. Thank you so much. Appreciate your
All right.
time, doctor. We're
Thank
back
you.
after this.